All right, so welcome everyone to our webinar on reporting on gender-based violence, especially in the face of COVID-19. This is part of the ICFJ Global Health Crisis Reporting Forum. For anyone who's not familiar with the work that we're doing here to help journalists reporting on COVID-19, we recommend you definitely check out the Facebook group and check out icfj.org and ijnet.org to find resources we've been collecting to support journalists. We're doing a bunch of these webinars and we really, encourage you to tune in to as many as you can. It's really a great opportunity to talk directly to sources about a bunch of different aspects that we're dealing with here during the pandemic. All right, so it looks like everyone, we're live now on Facebook, so we're ready to get started. I'm here today with Luisa Ortiz Pérez, Hazel Friedman, Jess Hill, and Marie Cunningham. And we're here to talk about the health crisis at home, so reporting on gender-based violence. I'm gonna let all the panelists go around and introduce themselves and give us a little bit of an introduction about what you do and specifically what your work is focused on regarding gender-based violence. So Luisa, we can start with you.
Thank you very much. It's beautiful to have a woman speaking about such a topic and in this particular context. So I salute all my sisters today and everybody who is watching. People call me Lou. Apparently Luisa is too long. So I'm Lu Ortiz and I'm the executive director of vitactiva.org, and we are a helpline for journalists, activists, and freedom of expression defenders around the globe who are experiencing violence online. And in the context of the pandemic, we have basically shifted or opened our mandate to include support, psychological first aid support for all of those who are experiencing vicarious trauma, direct trauma, anxiety, COVID brain, as well as stress. So all of those things in either one-on-one or a group setting. And I would leave it at that and leave the space for somebody else to introduce themselves.
Yeah, thank you so much. So Hazel, if you want to introduce yourself really briefly here.
My name's Hazel. I'm an investigative journalist and producer with Special Assignment. We're a current affairs investigative program. But during COVID-19, I've also been doubling up as a reporter covering aspects of the pandemic. And just very briefly, I'm going to dive into the deep end. On June the 15th, I reported on a court case involving a suspect who was going to be charged for the murder of a mother and her daughter, his biological daughter and his intimate partner. I did a body count that day from the 1st of June to the 14th of June and determined that 14 women and children had been killed. I was wrong. By the time I got home that afternoon, 3 more bodies had been found. And the very next day, when our president did his address, he counted 21 women and children killed within a 2-week period. So basically, gender-based violence is not even a shadow pandemic of COVID-19. Gender-based violence has been the primary pandemic in South Africa for years. And what I'm hoping is that journalists will now make the crossover from reporting to advocacy and certainly from analysis to activism.
Yeah, thank you. Marie, if you want to introduce yourself.
Absolutely. Good morning. I'm Marie Cunningham. I'm talking to you from what the governor of Connecticut called the Wuhan province of the American pandemic in New York City. I am a Lipman Fellow at Columbia Journalism School, specifically to report on domestic violence during and after the pandemic. To follow up on what Hazel said, the time when women are and children are most at risk is when they decide to leave. And the thinking is that there will be a great many women who, after being closeted with their abuser for 2 to 3 months here in this country, will decide to leave, and there will be a flood of, of new murders, unfortunately.
Yeah, all right, and Jess, just say a few words to introduce yourself.
Sure thing, Taylor. So my name's Jess Hill, and I'm an investigative journalist and author from Sydney, Australia. And I've just published a book last year called See What You Made Me Do, which is about the phenomenon of domestic abuse more broadly, but particularly in Australia. I've rewritten the book twice now, once for the US and for the UK. That's coming out later this year. And I've been working on the issue for 6 years exclusively and obsessively now. And it's interesting what Hazel said about that, you know, crossing over from journalism to advocacy. I never intended to do that. It just happened, you know, because I think once you get across what's happening, it's impossible for you not to advocate. When you make this your sort of primary reporting beat, I guess, you know, and so that's what I've been finding, that, you know, it can be an awkward space to be in as a journalist, but I think an inevitable one.
Yeah, thank you so much. And yeah, that's really interesting and something I'll definitely ask you guys about a little bit later, just kind of walking that line between reporting and advocacy, and especially such an issue like this that can, like you said, Jessica, very consuming, and you just have to, like, want to be able to act. So we'll definitely get into that later, but I want to start with like a pretty straightforward question so that we can kind of, you know, set this webinar off on, you know, so we're all on like the same page or have like the words to describe what's happening. You know, there's a lot of different terminology that we hear about to kind of refer to the same thing, whether it's gender-based violence, that's the one we use here at IJNet, domestic violence, you know, intimate partner violence. Are these all referring to the same thing? What term do you prefer when you're talking about this? And yeah, and how can kind of journalists navigate this challenge with using language to describe what's happening? I'd really like to hear from everyone on this, just a little bit about your own perspective, and especially since everyone has regional differences that they're taking into account. So if we'll just do the same thing, so we can start with you again.
Sure, and I'm glad that you mentioned the context and the regions, because that's what I wrote, and that was my first point to make. The terms that we use are definitely contingent to the context, to the culture, and to the language that is used, not only linguistically, but also the person who is speaking. For us, who are the boots on the ground, we basically ask people to define what is happening to them, and bounce that concept back with them so that we are understanding completely what is happening. That is not the language that we could use in a conversation that is academic, and it's definitely not the same language that we use when we are in a policy conversation or context. Definitely not the same language that you use when you're with the police or when you're with your lawyer. So the legalese versus the popular discourse, y después si hablo en español, then everything just starts getting, you know, on top of everything else. However, I would like to say that I prefer intimate partner violence or gender-based violences in plural to refer to what is called the in-house phenomenon, as well as that which happens to us as women for the mere reason of being women.
Yeah, thank you. Hazel, if you want to just take the same question.
I certainly do agree with Louisa's interpretation of that. I prefer gender-based violences to gender-based violence. And while certainly the commonality is that it's violence against women and girls predominantly, I think it should also be inclusive of the LGBTQ community as well. And I do see a slight difference, not in terms of severity, but certainly in terms of manifestation, for example, between intimate partner violence and the more broad definition of gender-based violence. Intimate partner violence takes place within a slightly different context to what we understand by the broad definition of gender-based violence, which is often also associated with femicide, murders of women because they are women, or murders of little girls and boys, I might add, because that's also an horrific statistic in our country, the murder of little boys. So yes, but there are little differentiations, but I would agree with the term gender-based violences, definitely.
Great, thank you. Anne-Marie, if you want to do the same thing, same question.
Certainly. I am specifically covering violence that affects women of color. And I agree that with Lou that it's very important to ask what they are experiencing, because sometimes people don't even know that they're being abused. Advocates have some new tools. There's one called the control wheel, and victims often answer the questions and don't realize until they've done so that, oh, I'm not allowed to have a car. Oh, I don't know how much money we have in the bank. That they are being abused. And there's even something called spiritual domestic violence, which involves not being allowed to practice your religion. This often affects Orthodox Jewish communities. So it's, as I agree with Lou, it's very important to ask the victims what they are experiencing and help them come up with definitions.
Yeah.
I also am planning, I'm going to be using my fellowship to travel to Mississippi to work with the Mississippi Center for Investigative Journalism, investigative reporting, which was founded by Jerry Mitchell, who reporting revived the cold cases of murder from the civil rights era. So I will be interested to see if there are, because I'm a New Yorker and a Northerner, I will be interested to see if there are different regional differences as far as definitions are concerned in the Deep South.
Yeah, that's a great point. And then Jess, same thing.
Yeah, so I diverge a little bit, and it's a decision that I made just a few weeks before sort of hitting print on the book, and I actually decided not to call it domestic violence, but to call it domestic abuse. And the reason why was that, number of reasons, but one was I'd get questions from women saying, how are you going to represent the fact that for many victims, physical violence is not necessarily the worst part? And every time I use the word violence and try to sort of explain that violence can mean psychological violence, it doesn't need to mean physical, that just didn't really come across to people straight away. And it was interesting, there was an article written by a Pakistani woman here in Australia who deals a lot with women from the subcontinent. And she said that she'd have women coming into her service saying, well, it's not domestic violence because he never really hit me. But they described these incredible campaigns of domination and control and these systems of abuse. And so she really made it sort of her mission to change the term from domestic violence to domestic abuse. And I've found it's interesting, since publishing the book, it's the first question. It's funny you should ask this question too, but it is the first question everybody asks. Why did you say domestic abuse? And it's actually really opened up the discussion in Australia about this much more, because what I'm trying to really put the focus on is what goes much more unnoticed, which is coercive control. And just to quickly just set an understanding for people who may not understand that term or be familiar with it. This is a pattern of behaviour in which physical violence may be rare, minor, maybe barely present, or it could be sadistic in its extremes. But you have a pattern of behaviour that seeks to strip the victim of her liberty most of the time, to take away their sense of self. And it's a systematic campaign of domination and degradation in which abusers seek to dominate their victims by isolating them. Very big focus on micromanaging their behaviour, humiliating and degrading them, monitoring their movements, gaslighting them, and creating this environment of confusion, contradiction, and extreme threat. And what we know is that coercive control is about 7 times more likely to end up in domestic homicide than just where physical violence is present without that overarching system of control. So that's why I decided, I think no term is really adequate. I think we all know that, intimate terrorism gets pretty close when it comes to coercive control, but that doesn't describe the other types of domestic abuse that don't have that overarching system. So I thought, like child abuse, we don't call it child violence because neglect and molestation and other non-violent forms are included. That's why I decided to call it domestic abuse.
Yeah, thank you for, bringing that up. And I think everyone kind of had 2 really good points. Of one is really understanding what the people that you're interviewing are experiencing and mirroring that. but then also thinking and considering your audience and what terms are people going to really latch onto and understand. So I kind of want to expand on what you started to talk about, Jess, just about how many different forms this can take. I think that especially maybe because of the terminology we're using, people tend to think first of physical violence that's happening. But, you start to get into what other forms of violence can be occurring or other forms of abuse. So can we all kind of expand on that a little bit, on that definition of what we're talking about that can be happening? And if anyone can kind of put that specifically in the context of the pandemic and whether they in their own like research or investigations have seen certain aspects of that increase. And we'll kind of go backwards. So maybe Jess, if we kind of start with you, I know since you started talking about that, maybe you can also add a little context with the pandemic.
Sure. Yeah, I mean, it's interesting. I think we have, and it's very hard to avoid this kind of reporting because reporters want something that they can just, land on. They want statistics. They want to so give some indication, and statistics are incredibly misleading in this area, as we all know. And so, like, there was a UN report that came out that said if lockdown continued for 6 months longer, we'd be looking at 31 million additional cases of gender-based violence or domestic violence. And so that sort of research, it's kind of difficult to understand what even that means, but it also frames it as what people think is a rise in incidents. And so it really foregrounds that incident-based approach to domestic violence, or domestic abuse, which looks at putting really physical incidents at the pointy end, as though this is just a collection of one-off incidents, rather than what is, often a system of ongoing abuse that never switches off. So I think that's been a bit of a pitfall in some of the reporting, and I know I've fallen victim to it as well. So it's very hard to avoid. I think what we've seen happen in Australia since the onset of the pandemic is quite similar to what we've seen elsewhere. The murder rate in Australia in May was double the usual domestic homicide rate. Frontline services were reporting an increase in complexity and severity of the reports they were receiving, as well as a higher rate of women reporting for the first time, which I think is really interesting and telling. Interestingly, in Australia, there was kind of a war of words between police and their statistics and frontline services and their statistics, because police statistics showed no increase. And so they were releasing these sort of press releases saying, oh, there's been no increase in domestic abuse. See, everything that was sort of foretold hasn't come to pass. While frontline services are saying, well, we've had a 15% increase. We're seeing much more complex and severe cases. Maybe women just don't feel safe enough to report to police. Mm-hmm. So I think just as a sort of broad sort of telling there, it's that when we're reporting on this, we really have to avoid falling into the seductive sort of area of reporting on incidents as though that is the definition of domestic abuse. But secondly, that statistics are very difficult and can be misleading, and you've got to contextualize it. And it's a danger to go to one area like police and not go to other areas like frontline services and think you've got the whole picture. Because in Australia, I think 20% of victims who've experienced abuse in the last 12 months have ever reported to police. So there's 80% who the police just aren't seeing. So those statistics are just telling us who's reporting to police. It's not telling us how much violence there is.
Yeah, thank you. Yeah, we definitely, I think we'll have to get into a little bit more about this discrepancy in reporting and how to navigate that as journalists. So Anne-Marie, if you want to kind of take the other question though, just about what other forms of abuse can take and how you've seen that in your own context, and then what that looks like just specifically in the context of the pandemic.
Sure. Certainly, the pandemic has added another arrow to abusers' quivers. There's certainly been a lot of abusers saying, if you don't go along with what I want, I'm going to throw you out and you will catch the virus. Or if you call the police, I will go to jail and I'll catch the virus and I'll give it to you. That's certainly been, there's certainly been a lot of that. as far as the police are concerned, there's the National Coalition Against Domestic Violence, which was founded by the Violence Against Women Act, promoted, that was authored by Senator Joseph Biden, and the National Coalition has local chapters in every state. The National Coalition has a pilot project here in Kingston, New York, to look at innovative ways that women can report. And one of them is to text to the police instead of having to make a call, which would be very helpful during the pandemic when women are closeted with their abusers and both partners are home and cannot make calls in private.
Yeah, thank you. Hazel, if you just want to talk about your own context and what you're seeing.
Sure. We picked up two major trends within the lockdown period of COVID-19. Within the first 3 weeks, now, first of all, South Africa implemented a very, very hard regimented lockdown in which alcohol was also banned in addition to tobacco products. In the first 3 weeks of lockdown, when alcohol was banned, surprisingly enough, although there was an increase in reports of domestic abuse, about something like up by 34% from the year before. And again, I'm also not going to trust the statistics because you need to break down the statistics. But incidents of rape seem to have decreased. And that's not necessarily because men or rapists were behaving themselves, but because we were in lockdown, it was all happening behind closed doors. The sense of isolation was greater. And also what I had received reports from women's shelters related to was that the intensity of domestic abuse had increased, whether it was just an outpouring of frustration because partners were in the same environment and couldn't leave each other, whether it was the absence of alcohol that had exacerbated that. But then, very frighteningly, from when alcohol was unbanned from the 1st of June, there was a spike not only in incidents of domestic abuse, but as I said, in femicide, in murders of women and children, but to such an alarming and brutal degree that it was absolutely horrifying. Now, alcohol, of course, is one of the main triggers of gender-based violence or domestic abuse, but alcohol is not the cause. I mean, COVID-19 doesn't make killers out of men or even young boys, because young men are also perpetrators these days. So basically, what it was doing was magnifying a systemic atrocity, really, that is ongoing and that needs to be addressed on all levels. And we as journalists and reporters, I mean, there's a sense of anger and outrage on the part of activists who also had to put gender-based issues on the back burner because they had to provide humanitarian aid to struggling communities, often where gender-based violence and domestic abuse is particularly rife. So they had to focus on providing food relief while all this violence and abuse was ongoing. And now they've decided the time was overdue for memoranda, protests. They've been doing that for years. They have to decide on another course of action to change the systemic violence.
Yeah, thank you. And Lou, if you just want to take the same thing.
I don't know why we failed in the beginning to make a trigger warning note. So as my triggers are arising, I would also like to tell everybody who is listening and all my sisters in the panel that we're in this together, and that whenever you feel like your triggers are pushed, you can basically just walk for a little bit, take a deep breath, take a drink of water, because we are discussing very, very difficult topics that also intertwine with our personal lives. And that said, I operate, the helpline that we work on operates throughout Latin America. And the different conditions, depending on each country, vary so much, from serious total lockdown with jail and fines in El Salvador or Nicaragua to Bolsonaro in Brazil, who completely disregards anything related to COVID, or AMLO in Mexico, basically taking pictures, kissing babies, hugging grandmas. So the region is very diverse. However, there are three aspects that I want to touch on. On the one hand, the traditional roles that women occupy in Latin American societies, not only because of the Catholic religion or evangelical religions, but also because women traditionally, and even professional women like you and I, occupy roles, traditional roles of caring. And those roles in the pandemic are intensified. You will not only care for the basic needs of your family, but also you will bear the brunt of the increased presence of child caring because there's no school, the elderly, because people multi-generational living situations, and also the fact that not a lot of people have the luxury of being able to stay home. So the incapacity to isolate because you bring food to the table through the informal economy or through the underground economy, or what people in Silicon Valley love to call the gig economy, which is basically bring your cards out on the street and sell whatever it is that you bake at home or whichever way you earn your living, is going to intensify the pressure in the household. If you put all of those aspects together, what you find is what has been defined as a perfect storm. And I agree with all my sisters in the panel. We all, are in alignment to the causes. There's one last thing that I wanted to say, and that is domestic abuse is a matter of control. And in the case of Latin America, there is a growing trend of connection with the digital world and the attempt to control and to abuse using extortion with intimate pictures or intimate materials, trolling, or even revenge pornography as a way to attack, to suppress, and to silence the women that are in households, in working situations. So online violence is real as well, and it is increasing in the context of the pandemic because there is a lot of idle people online just looking for a way to control, or as Jess was saying, just to enact in really horrific ways.
And Taylor, do you mind if I just build just very quickly on what Louise was saying? I think it's really,
definitely.
it's sort of, it's tempting in these conversations that we talk a lot about the victim's experience, but sometimes we sort of err on not talking about the actual perpetrators. The perpetrators fall away from view. And I just wanted to add just another sort of thing to think about. And that is, in any time of economic recession or insecurity, let alone everything else that's going on, you see a rise in domestic abuse, in the level of physical attacks, etc. But I think I've looked quite a bit at the background role and the underlying role of shame and how that can get expressed as humiliated fury in men in their perpetration. And I think when perpetrators experience this sort of intense humiliation or shame, when they lose their job or they lose a sense of public identity or they lose a sense of who they are out in the world, they're likely to express, because they are prone to abusiveness, they're likely to express that as humiliated fury in the family space as a way to reassert some semblance of control. But I think also for some coercive controllers, the real worry is that actually these conditions have suited them perfectly, and that they have experienced the type of relationship and conditions that they have been trying to create artificially prior to lockdown, where their partner doesn't work, where their kids don't go to school, where everyone's focus is in on the home and on the relationship. And I think what domestic violence services here in Australia have been really worried about is that when lockdown restrictions lift, what happens if those coercive controllers feel their control start to slip and decide they want to seek to reassert that more aggressively, to recreate this almost sort of fantasy conditions that they'd had this, tenuous grip on. So I think just, if we can try, it's very difficult sometimes because perpetrators, they want to be invisible, and they want to be taken out of our language as well, but trying to sort of keep centering them and why we're seeing the sorts of things that we're seeing from men in this space.
Yeah, yeah, thanks for that. And also thanks, Lou, for just mentioning the trigger warning. That was like an oversight on our part. These are obviously very, yeah, very difficult things to be discussing. So we just want to encourage everyone to, take care of yourself first when listening to this. And, we'll be sharing a couple hotlines in the chat, but as reporters, first of all, I think we need to make sure we're aware of the hotlines that are available in our own countries and contexts, and be able to share those whenever we're discussing these topics. Since we're dealing globally, right now it's a little difficult to share one that will that everyone will be able to use, but we definitely just encourage you to be aware of those resources that you have in your own country, and to share those out when you're sharing your stories. So one more side here is just, I want to encourage everyone who's watching to share any questions that you have in the chat. We're going to do a couple more questions that, I've created before this, but I also want to make sure that we include time for anyone who's watching live to share their own questions. So yeah, so please feel free to do that. We'll move to questions here soon. All right, so I'm gonna, sort of bring in other things we've seen happening, and right now what's happening globally, and started in the US is all these protests related to racism and police brutality and things. But I think that there's a lot of overlap in what we see and how race and identities intersect when talking about domestic abuse and violence. So Anne-Marie, I'm going to start with you, since I know your own research focuses specifically on, women of color and how they're experiencing abuse. But if you just want to start, and then if anyone else has things to add, I just encourage you to jump in after Anne-Marie gets started with that, talking about how these identities are going to intersect.
Thank you, Taylor. Yes, I would be delighted for any tips or advice that other panelists want to give me. I've run into two problems with African-American women. First of all, this is a bad time in this country to criticize the Black community in any way. And of course, my reporting will criticize Black men. In Mississippi, police tell me that a lot of the time women say, "You've already arrested every man in this town. Why should I help you arrest another one?" So that's one difficulty that I'm running into. The other problem is that New York City is the city in the country with the largest American Indian population of urban Indians. And there are also a great many Indians in upstate New York. In Mississippi, and Mississippi is home to the Choctaw Band of the Mississippi Band of Choctaw Indians. I have good relations with the Domestic Violence Center there, but Indians in general do not like reporters. And I have to remember to do things like not ask direct questions, and if I make an appointment with someone, drive to their home and wait outside for them to invite me in. I can't just knock on the door. So there are certain procedures that have to be followed, and I'm sure I don't know all of them. So I'm welcome to, I'm open to advice, tips, anything that anyone would like to tell me.
Yeah, go ahead. Whoever wants to jump in here next.
I wanted to build on what Anne-Marie was saying. Are you referring to Native Americans, Anne-Marie?
Yes, American.
Okay.
Some people like to be American Indians. Some people like to be.
At some point, I was thinking about people from India. So I didn't know exactly, but I mean, it's all right. Thanks for the clarification.
Sorry, those are known as South Asians.
Well, from the point of Latin America, the pandemic came right when we were at the cusp of something really beautiful happening. And that was around the 8th of March, 8N. And if people haven't seen it, or you haven't come across the work of Las Tesis from Chile, and it was not my fault where I was or what I was wearing, La culpa no era mía, ni dónde estaba, ni cómo vestía. The clamor and the physical presence of millions of young people, women, and everybody out asking a very simple question: when is enough? Yeah. And the pandemic comes where the wave, where they call the green wave, because it was also connected to sexual and reproductive rights, access to safe abortion, which is jailed. It's cause for jail and prison in some countries in Latin America, was completely halted. Everybody was asked to come back in, and that kind of the removal of air to all of the feminist movements in the continent is being felt, and it is being felt in terms of how state-sponsored violence also heightens the lack of reporting on gender-based violence, the way that the policing of the state and the hypervigilance of what women do heightens gender-based violence. And so it is important to remember that the fact that we are home doesn't mean that we haven't stopped fighting. And so maybe from a glimmer of hope, twink of an eye, I just want to say we're just figuring out ways of hacking the isolation, because the claims are still out, femicide is still out, violence is still out. So how can we fight it from the confinement?
Could I also add something there? And it's actually, you were talking about March being a particularly significant month. For us, okay, March was International Women's Day, but for South Africa, it was a march of mourning, because again, the amount of gender-based violence cases had spiked horrifically, with children being the primary victims. Domestic abuse was on the rise, but activists were finally gaining ground in terms of mobilizing, uniting the country. We had this 1 Billion Rising South Africa movement that had marched in September the year before, had galvanized tens of thousands of South Africans of all races, classes, creeds, genders, to march to Parliament to demand decisive action on the part of our government. Again, we were let down, because when it came to actually walking the talk, it was all very well to pay lip service, but there were no decisive laws that were introduced. Our criminal justice system wasn't tightened up to prevent parolees who had raped and murdered before from coming out and repeating their offenses. And in March, it all culminated again with activists, survivors of domestic abuse and gender-based violence, taking to the street and saying, enough is enough. And then COVID-19, and all of that activism, although it didn't die, it had to be put on the back burner. And I think that has been a source of such immense frustration and despair, not only for survivors, but for the activists who've devoted their lives, who try to hold government to account, to say, look, all right, it's all very well to pay lip service and mention the names of the victims. I mean, the hundreds and thousands of names, but you actually have to start enacting laws. We have to do a multi-sectoral approach. We have to go to schools. We have to start with family education as well. It's massive, it's intersectoral, it's multi-sectoral, and yet everything now is focused on COVID-19.
All right, so I think we're gonna move to audience questions. I see a lot of them coming here. So I'm gonna start with, so let's see, from Megan, who asks, in terms of reporting on domestic abuse, what stories are underreported or warrant reporting? So what stories, would you recommend people to dig deeper into? Jess, we can start with you, and then anyone that jump in can just go ahead and do so.
So the most chronically underreported story, as far as I'm concerned, is the family law courts. And that's because in a lot of countries, the restrictions on reporting on family law are quite tight. In the UK, the privacy restrictions are insane. I mean, the amount you're able to report on a case is to give just the general outline. You can't give any details of a case at all. It's incredibly difficult to report on. In Australia, we have a section of our Family Law Act which says you cannot identify any parties to a case, which means you can't really do television stories on it. It's harder to do radio stories, but not impossible. But there's major fines for breaking that, and even jail time for journalists if they do identify any parties to a family law case. And what's happened as a result of that is that journalists have just stayed away from it entirely. And in the meantime, in the 20 years or so that they've sort of stopped reporting on it, it's become, I think, certainly in Australia and I think in other jurisdictions around the world, one of the most dangerous institutions for children, because in the family law courts, there is a pro-contact ideology that is spread across the world where it is more important for children to have contact with both parents than it is for children to be protected from contact with someone who has been even convicted of abuse, either of their other parent or of the children themselves. So people with actual convictions for violence, for rape, for child abuse are being given access to their children, or more rightly to say, children are being ordered to spend time with that parent. And it is just, when I started reporting on the family law system, it turned my world entirely upside down. Everything I thought the justice system might be able to provide for people, I guess I was quite naive, was just shattered. And ever since, it's really largely driven my continuing coverage of domestic abuse. And then at the back of that, I think the coverage of what happens to First Nations women, especially in Australia. You have First Nations women in Australia who will ring police for help. Police will turn up to the house, they'll do an ID check on everyone in the house, and they may arrest the woman who's called for help for having unpaid fines, for something as minor as having an unregistered dog. And in one state in Australia, they were actually being jailed for having an unpaid fine, and jailed for so long as it took for them to pay it off at a rate of $300 per day. So their children were being removed, or, the kinds of consequences of that have been massive. And in Australia at the moment, we see a really enlivened Indigenous movement with a lot of non-Indigenous allies joining. And what I really want to see is it moving past just police brutality, but more to the way that police are punitive towards women who seek their help when they are in domestic violence situations. And I'm sure, the same goes in the United States. Reporting on First Nations violence, especially the Native American situation, is just so underdone compared to the amount of violence that's going on. So they're my sort of two areas.
Yeah, thank you. Does anyone else want to jump in on that same question about stories that are underreported?
Yes, I will. I couldn't agree more with Jess. Anything that has to do with First Nations, Native Americans, American Indians is underreported. Also, there are Black women are twice as likely to be killed, more likely to be killed than white women are. And 56% of those murders are done by intimate partners. And that is truly ignored. There's a Black woman lawyer here in New York City in the Bronx who keeps track of cases where the Black woman called the police to report domestic violence and ended up shot by the police. So yes, there's a lot to talk about.
And certainly, I think on all levels, whether it's holding your local police station to account for following up properly on rape or domestic abuse reports, on providing adequate victim support or survivor support, I prefer to call it, on having rape kits available, of being educated in terms of knowing how to deal, how to nurture, and how to be supportive of a survivor of rape or domestic abuse, or both. I think that's extremely important at station level. Also to, again, follow up on cases where the police have investigated, where the perpetrator has appeared in court, but there's a massive backlog in terms of just DNA evidence, which results in a case being postponed for years and years and years, providing families of deceased victims of abuse or survivors with no closure, with ongoing trauma, without there ever being a resolution in sight. I mean, the backlog in South Africa in terms of DNA sampling or DNA testing is just horrific. So I think it's at every level, holding all those within the chain that makes up GBV and domestic abuse accountable for their role in dealing with this.
Yeah, thank you.
Just the top of the cake with a strawberry or cherry on top. The phenomenon on everybody just wanting to know every single detail on the type of abuse that happened. And I'm just thinking of Epstein, Weinstein, and all of these kind of blockbustery, phenomenal stories on orchestrated long-term abuse. However, we underreport the consequences in the family life. We underreport the consequences on the local economy. We underreport the reasons. And we just generate this kind of, I want to say, gender-based violence addiction on people to know the gritty details, because that makes good news. And in Latin America, it is just basically constant tabloid fodder.
In South Africa, we have a term for that. We call it trauma porn. So,
yeah, I'll never forget. There was a woman who I met whose father and whose niece and nephew were murdered by her sister's ex, and a journalist actually approached her and asked her to tell the journalist how long the blade was.
Oh,
You know, like that wasn't that long ago. Like, it just boggles the mind.
yes.
But sometimes it's the editors. Let's talk about that, Taylor, because sometimes it's what is requested. And what happened to the anonymity of the person? What happened to their capacity to be able to, keep things off the record? Because the question for us as journalists is, what can we bring in? And what do we actually would like to not bring out?
Yes, if I could speak to that. Your editor certainly will say, this story needs the voice of the victim. So, and you may want to keep the victim may not want to speak, or for their protection, you want to keep them totally anonymous. I have talked to reporters, I have not done this myself, but I have talked to reporters who have worked with victims very, very carefully to make sure to disguise their name, other details, to make sure that the correct details that are mentioned because the editor has demanded something, are accurate but not dead giveaways. Sorry to use such a phrase. It can be done, but any journalist should work closely with the victim to make sure that they don't betray them in any way.
Yeah. Oh, sorry if anyone wanted to jump in. Sorry, I'm just going to add one more thing to this, because someone asked a similar question. Sorry, too many people. So Tanya had asked a similar question about, this kind of battle with your editor. And she says, how do you write stories about violence that's not physical? You probably have the version from the victim. So the problem is that I have my stories, but the newspaper I work for, they feel that it's just a story of like her word versus his word. And, it's either hard to get these stories printed, or the only type of, evidence they can find or to support it is a police report, and how, she's just having difficulty even getting these stories told. So maybe we can just add that into this conversation about, even as a journalist, if you know what to do, your editors have another idea.
I think there's also another challenge, and I'd love for that question to be addressed that was just asked, but there's another challenge in terms of the medium we use. For example, although I am an author and a print journalist, I'm essentially a television producer. And as I'm sure you all are aware, television is the most profoundly shallow medium you could ever work with. And as our credits have rolled and we've, the titles go and we move on to another story, the pain of survivors and communities and individuals who've placed their trust and responsibility in us to tell their stories with sensitivity continues. So as a television producer, it is an incredibly sensitive topic because we've got to tell by showing, but we've also obviously got to respect the boundaries, the intimate spaces of pain, of loss, and of grief that we encounter. And sometimes you've got to know when you do not lift up that camera, and all you've got to do is listen and take your cue from the person who has entrusted you into that horribly emotional, grief-stricken place. So I think those challenges for television are immense, and we don't always abide by the laws of respect for interviewees and for survivors. So.
Yeah, so when you're working with visuals like that, what would you recommend? Even if you're a print journalist, you still have to work with visuals too. Yeah, Anne-Marie.
I would recommend that the newspaper reporter talk to advocates at shelters, organizations, National Coalition, elsewhere, to find out, to ask them about similar cases. That will add to the validity of her source.
Yeah, I'd also just add to that as well that, there's a way of writing it, not so that it sounds like you're not backing your source, but of saying that, so-and-so says that this happened. So you're not saying, oh, this happened. You're saying that this is what this woman is reporting, and therefore you're not on the hook for establishing truth, although you as a reporter obviously are wanting to verify as much as one possibly can. I think also to try and make it clear to the editors that if anything, women under-disclose. That is the general, pattern. You're not going to get a perpetrator most of the time, unless they've been through a lot of personal work, admitting to it, taking responsibility for it, or corroborating her story. So if you can't take the story from her, you're not going to tell the story at all. That can be very difficult to get across to recalcitrant editors. I think on the physical violence side, what has shifted the game a bit in Australia is we had a very high profile murder of a woman and her 3 children earlier this year, and it was clear from her family and what they said afterwards that there was almost no physical violence in the relationship, and that was what started the media here really talking about coercive control and suddenly being much more interested in all of the sort of those controlling aspects I spoke about earlier, leading up to homicide. So that may be another way of coming at it, saying coercive control is actually more indicative of potential homicide than physical violence alone. That's why we've got to be really identifying it, because our job as journalists, maybe to say to the editor if they're this way inclined, our job as journalists is to educate the community, on this, and so that women who read this story may see themselves in it,
Yes. There is something to be said from the Latin American context and probably the US context as well. And that is the increase in reporting on violence. And I mean, if I say my native country, Mexico, you think of drug dealing violence, gang violence, as well as just horrific state-sponsored violence at a very large level. So the challenge from the journalist point of view is not only to move aside from this tidal wave of constant headlines of what would seem the narco aesthetics of more horrific after more horrific, which is also subconsciously informing perpetrators of gender-based violence on trickier ways of being really almost theatrical in the way violence is displayed, but also the possibility of explaining that gender-based violence is parallel, but it is not connected. It is not necessarily the same thing, because we then fall into the stereotyping. So just the woman covering her face because she's going to be hit, or the person with, physical bruising, or the corpse in front of the house, etc., etc. And those are guidelines, those are topics that need to be taken with creativity, respect, and also responsibility.
And something that's really taboo is talking about women's resistance, like violent resistance, agency, strategizing, you know, women as not just vulnerable, as you say, cowering in the corner, but who are like surviving on a minute-to-minute level every day, who are becoming masterful strategists. And I was on a panel just yesterday with two victim survivors talking about resistance and agency, and they're just really sick of hearing victims described as vulnerable and as, you know, these poor women who we should have pity for. They're like, don't have pity for me. You know, like I was fighting back, you know, I needed help, I needed assistance, I needed a place to just be safe, but don't pity me. You know, I don't want your pity. It's almost insulting, you know, for some women, and it stops them from identifying as being victims of domestic abuse when they keep on seeing the same thing. And it also stops courts from seeing victims as anything other than the ideal passive submissive victim. And when they see violent resistance, they're like, well, you're not a victim, that was mutual violence.
Yeah. So it looks like we're just about out of time. I'm sure we could keep talking about this for a very long time. But I would love to just kind of turn it over to you guys for some, you know, closing remarks, whatever you want to call it. And if you can just kind of end with some, like, you know, top tips or, you know, some really great takeaways for journalists. I know we've touched on a lot here, but if there's anything you want to add that are tips for journalists who are covering this topic, definitely stick that into your closing remarks. So Hazel, we can start with you, and then we'll just go around.
Well, I just wanted to thank the International Center for Journalists for initiating this webinar. I think the timing couldn't have been better and more crucial, obviously globally, but specifically in my country, which is really being crippled not only by gender-based violence, but all those intersecting factors like unemployment, like the socioeconomic inequalities that have plagued our country for decades. So gender-based violence, while I said, is not the shadow pandemic, it is the primary pandemic. It feeds into so many other of our socioeconomic ills and woes. And I think that all the panelists here today provided such fantastic fodder for future thought and action. And I particularly love the words like respect, sensitivity, non-stereotyping, and certainly making the shift from victim to survivor. And as I said, possibly looking at the role of journalists, not as passive reporter either, but as advocator and even activist. Thank you so much.
Yeah, thank you. Anne-Marie, we want to go to you.
I do appreciate the opportunity to have this seminar. Thank you to the center. Thank you to you, Taylor. And thank you to all the participants. I'm delighted to see that some of you have said this was timely and helpful. I want to say to all the journalists out there, keep on keeping on. This is a huge story. 1 in 4 women in the United States can be expected to experience domestic violence in her lifetime. It's horrifying. And it sounds like it's worse in other countries, given what some of my fellow panelists have said. I will follow all of you and look forward to reading your stories. Thank you again.
Yeah, thank you. Lou?
I chime in the thanks and the gratefulness for convening a womanal, which I adore. And I want to turn the mirror around. Journalists, sisters, hermanas, you have to take care of yourselves. These are not easy topics. And we need to rely heavy on self-care. We need to be able to protect ourselves from vicarious trauma as much as we can by being good to ourselves, by being honest to why and how we are doing the reporting that we are doing. And we really need to work on our triggers and the connection that we bring into the story. because we need to show up as our full selves, our full racialized, our full genderized, our full intersectional selves, because that's when we do good reporting, when we show up and we show up for others. So thank you for all the work that you all do reporting, and thanks for this really great conversation.
Thank you. All right, and Jess.
Yeah, thanks, Lou. That was a really beautiful note to end on as well, because as someone who did not always engage in great self-care, I'm learning how to do that better, and it means you can stay in the area rather than burning yourself out like this wild candle. I guess I just want to finish by saying, like, this is, to echo what everybody's been saying, is that this is a huge story. It's the leading public health issue in a lot of countries. It's the leading law and order issue. It's the leading social justice issue in a lot of countries. You know, like, this is something that people have thought was just like a private thing that we don't really talk about, or that it's sort of really awkward. It's like, this is happening not just in private, it's happening in public. You know, it's happening out throughout our systems. And it's just, when you start tapping into this topic, there are just so much to report on. There's so much to debunk. There's so many opportunities to educate in a way that is utterly fascinating. And I think, just as a last thought, you know, it's really important that we don't just have victim survivors in our stories as color, you know, but that we actually include them as experts, not only in their own experiences, but experts in the systems they've interacted with. Include their expertise, because they are really under-resourced, and we'll often just go to an advocate for their expertise, and then we'll just go to the victim survivor for their trauma story. But that also is not doing much for the victim if they can't have that catalyze into something more meaningful for other women and children. It's difficult to just keep repeating your trauma story without ever being considered an expert in your area. And I think that they have a lot to offer. So start tapping into their expertise a little more, and you'll find that there's just so much there.
Yeah, well, thank you so much. Thank you to all our amazing panelists. And thank you to everyone who's listening and who has been engaging. We haven't been able to get near as many questions as we had hoped, but that's always how it goes. So we're, just happy to see that everyone is active and engaged. Definitely follow all our panelists on social media, follow their work, and check out ICFJ and IJNet.org. We'll be posting a recap of this webinar and any of the other webinars we're doing. Check out the Global Health Crisis Reporting Forum to connect with other journalists working on all kinds of issues related to this pandemic. And we also just encourage you to check out IJNet, where we have a lot of other resources for reporting on gender-based violence, and we'll continue to do so since we know it's such a huge topic. So thank you all. Thanks everyone for listening, and see you later.
Thank you, Taylor.
Thank you so much.
Thanks,
Bye,
Taylor.
everybody.